going on. Before we start, I'd like to kind of set the stage a little. There is an agenda. If people in the audience do not have an agenda, they exist. I think they're at that table there, and I'm sure they could be passed along. But I'm going to read it because it's pretty straightforward. First, we're going to have the staff do a summary of the September 8th and October 6th meetings. Then each work group has 5 minutes. We left one thing out. I was going to mention the changes that were being made to the bill that we know about at this point, which is not to say that we know exactly what the bill is going to look like, but as the sponsor of the bill, I've talked with people, and there are some changes that have been agreed to. So I'll explain those. Then each work group member will have 5 minutes to discuss his or her views. And then any discussion among the work group. This, as you recall, is not a body that is intended to make recommendations or do a report. We were created to study the issue. There's a person who I don't know sitting there, and I know she's not Senator Reedy. Okay. Thank you. Nice to have you here. I just kept looking and pondering. It's easy to confuse me, but that really did it. At any rate, this is not a public hearing. I just want to let people know that, though you are here and we appreciate and recognize that you're here, it is not a time for public input. The time for public input will be when there is a public hearing after January. But thank you for being here. I think that's all. Have I forgotten anything? Okay. So with that, I'm going to ask the staff to begin summarizing the previous meetings.
Good morning, everybody. You should have a handout that says Death with Dignity Workgroup meeting summaries. And I'm just going to briefly go over that to kind of refresh everybody's memories about what we talked about at the September and October meetings. So at the September meeting, April Morton provided an overview of the 2015 bills. And then the work group had an opportunity to hear from both proponents and opponents regarding their views on the legislation. The proponents, who comprised patients, family members, representatives of religious organizations, healthcare practitioners, and others, they highlighted the need for quality and not just quantity of life. And they talked about how Death with Dignity provided an additional option for individuals who are diagnosed with a terminal illness at the end of life. The proponents talked about how aid and dine was an alternative to other measures such as ceasing sustenance, and they highlighted the protections in the bill for individuals choosing aid and dying. They also stated that individuals with disabilities should benefit from the bill and not be hurt by it, as the bill recognizes that people with disabilities are capable of making competent choices about their lives. Opponents, who comprised individuals representing religious organizations, healthcare practitioners, elder law attorneys, and others, stated that life is a sacred trust in which policymakers have no right to intervene. They talked about how legalizing aid in dying devalues the lives of people with disabilities. And they also talked about how, despite the patient protections in the bill, there was still an opportunity for family members to coerce vulnerable individuals into ending their lives. Suggestions for improving the bill came from both work group members as well as the individuals who spoke at the meeting. Senator Reedy stated that the bill should require a witness to be present when a patient self-administers aid in dying. Senator Norman stated that the bill should require a periodic redetermination of a qualified patient's terminal illness. Various speakers stated that a psychiatric evaluation should be required for every patient. Senator Nathan Pulliam expressed concern about the role of nurses in aid in dying. Delegate Valentino Smith said the bill should require a qualified patient to have a DNR order so that a healthcare provider does not try to resuscitate the individual. Delegate West said that individuals who are not capable of self-administering aid in dying medication should be allowed to receive assistance. Molly Strauss, who was a healthcare provider who spoke at the meeting, said that the bill should require patients to fill out a depression questionnaire before being determined that they're a qualified patient. She, as well as Alexa Frazier, stated that the bill should require record keeping and data collection and reporting, as the Oregon and Washington laws do. Molly Strauss also stated that it would be a good idea to develop clinical guidelines for healthcare providers, as was done in Oregon. Delegate Valentino Smith stated that the bill should require a patient to certify that they are not seeking further medical treatment in order to be determined competent. Elizabeth Wegline, who represents the temporary staffing, nurse staffing industry, stated that the bill should enhance liability protections for healthcare providers, as well as allow an individual with dementia to obtain aid in dying. Senator Reedy felt like there should be a definition for coercion in the bill. Senator Norman wanted to set a higher bar for patients in order to qualify for aid in dying. Delegate West wanted to require a private conversation between the patient and their attending physician. And Elena Boisvert, who's an elder law attorney, thought there needed to be stronger patient protections to prevent undue influence by family members. At the October 6th meeting, the work group heard from a representative of the Kaiser Family Foundation, as well as individuals from Oregon and Vermont who had experience in the implementation of the laws in those states. The individual from the Kaiser Family Foundation talked about the role of Medicare in end-of-life care, and she stated that proposed Medicare regulations would cover an advance care planning meeting between a patient and their physician. And since the time of the October meeting, those regulations have actually been finalized, and they'll take effect on January 1st. Ann Jackson from the Oregon Hospice Association, who has been involved with the implementation of the law in Oregon, provided some numbers of the number of individuals who have received prescriptions for aid in dying, as well as the number of people who ingested the medications. She also highlighted that over 90% of individuals who used aid in dying in Oregon were enrolled in hospice. Very few individuals who used aid in dying were disabled, and the number of individuals who've been referred to a mental health professional in Oregon has declined since the law was first enacted. Linda Waite Simpson from Compassion and Choices in Vermont talked about some contrasting experience with Oregon. In Vermont, their law does not require any particular collection or reporting of information. They also have low utilization of hospice in Vermont. So those were two proponents of aid in dying. Rachel DeSanto is a family physician in Vermont who expressed many concerns about the implementation of the law in Vermont. As a family physician who cares for dying patients on a regular basis, she was concerned that because there is no reporting in Vermont, that there's very little information available on how the law is working in that state. And she also felt like Death with Dignity was distracting people from focusing on improving end-of-life care. Another person from Vermont, Lynn Caulfield, who is a home health nurse, was disturbed by the fact that the law helps, that it changes the role of healthcare providers from helping them live to helping them die. And she talked about how aid in dying does not necessarily guarantee a swift and pain-free death. Lynn Cleveland Vitzhume, also from Vermont, talked about, again, the minimal data collection and the fact that coercion remained a concern for her. So that's a summary of the first couple of meetings.
With that, I would like to talk about some of the changes for this group so that you know that the impact that the discussions have had. I have not discussed all of them. I think with Senator Young, you were here some